Scottsdale Interventional Forum started in January of 2004. The first one there was about 40 doctors in the audience. And now just by comparison, last year we had over 800 attendees. Physicians come from all over the globe, either as attendees or as faculty. I can tell you that the greatest cardiovascular minds on the planet come as faculty to teach at Scottsdale Interventional Forum. We have over 100 didactic lectures. We have a number of hands-on models and displays for people to use. We have a number of computer simulators so you can actually practice doing interventional procedures. But the pride and joy of this meeting is the fact that we do 14 or 15 live cases. In other words, the physicians, the cath lab staff, the nurses who come to this meeting, we all learn together, can see these live case demonstrations of the most advanced technologies, the most advanced catheter-based therapies for the treatment of heart disease.
I think that every private practice cardiologist will tell you that sometimes you feel like you're not as directly involved as you used to be in terms of new and different things. And this brings the technologies of tomorrow to the cardiologists of today.
One of the things that we're most proud of is the fact that we have an evening symposium, but not for doctors and nurses, but for the lay community, for the Scottsdale and Phoenix community.
To come to the forum and learn allows you both an access point to ask general questions, and it will expose you to terminology that your doctors will utilize with you, and that way you can understand it better when you're in the room talking to your own private physician.
My talk this year actually goes into the history of heart attack treatment. I think that it's extraordinary that in such a short period of time we've seen this evolution from coronary disease being largely a death sentence to being something now that you just sort of have to live with, but that really doesn't necessarily take away most of the things that you want to do in life. I think that coming to the community educational event is fabulous for anybody who has had heart disease or has had heart disease touch their families or their lives. It's a really great opportunity to learn more about the #1 killer in the United States and to be able to appreciate all the things that can be done now to help decrease your risk and help to manage that problem if it does arise.